AML is one of the most important topics from all points of view, whether it be USMLE or NEET PG. So, in order to understand the disease, first we need to understand about the background of the disease. Uh, Firstly, AML is the most common adult acute leukemia, which presents at the age of 65 years of age. The median age of presentation is 65. The patient will firstly present with common symptoms like fatigue, and then um, some B symptoms may be present, but they are unusual. What are the B symptoms precisely? They are night sweats, and they can be fever, etc. Often, the patient presents with symptoms of cytopenias. What they might be? Firstly, due to anemia, which is the amount of in which the amount of RBCs are less, so cytopenia of RBCs, it will present with fatigue and weakness. Next, due to thrombocytopenia, that is the deficiency of platelets in our blood, it will present to us with bleeding and bruising. Okay, and next, due to the deficiency of granulocytes, the patient will present with repeated infections and will show generally a history of repeated hospitalizations. Then, as it is a myeloid leukemia, there is a presence of hepatosplenomegaly, but it is rare, and there can also be a presence of lymphadenopathy, which is also a rare entity. Now, one important thing is that acute promyelocytic myeloid leukemia, acute promyelocytic, acute promyelocytic myeloid leukemia can present with severe severe complication, which is known as DIC. Now, what is DIC? DIC is disseminated intravascular coagulation. What is this? This is basically a consumption coagulopathy. Consumption coagulopathy, which means that the clotting factors are consumed, so the patient will present with bleeding. Now, how will diagnose the condition? The provisional diagnosis can be made by the different features that the patient is showing, but the specific diagnosis will only be possible after a thorough laboratory examination. There may be various cytopenias as denoted above. Then there can be an elevated LDH, or lactate dehydrogenase may be elevated. In the peripheral smear, we can see some myeloblasts with ore rods. Bone marrow biopsy is also a very important investigation, which will show hypercellularity with myeloid blasts. Okay, so this is all about AML. And being precise, these are the most important points that need to be kept in mind for solving the questions. Thank you.